Hi, I'm Becca, and for the last teeter, I have the foot and ankle teeter. And so the scenario I was given was a 26-year-old female presents 1 week post-op after 5th metatarsal osteotomy for Bunionette, and then focusing on the rehab strategies and interventions from weeks 2 through 8. So I actually found an article for rehabilitation after a hallux valgus surgery, which would be a bunion on the 1st metatarsal, versus the Bunionette on the 5th metatarsal. But just with my critical thinking skills, and I was able to basically relate what they did for the hallux valgus surgery to what they did for this Bunionette surgery, just on the 5th toe versus the 1st toe. So in the article that I found, they really focused on, they wanted to see how the plantar pressure was applied after the surgery, so the gait mechanics of the patient, because what they found is in patients who did not go physical therapy after their bunion surgery, that they didn't put as much weight through their 1st toe, and so their push-off was less, and then their gait mechanics were altered that way. And so what they hypothesized in this study was that by participating in like 3 to 6 sessions total of physical therapy, that they would be able to have that normal gait mechanic of putting that pressure through the heel and then through that 1st toe, even though they had that surgery on it. So the same thought can kind of be applied over on the 5th metatarsal, just that you want to have that normal gait mechanics after any type of surgery, so that physical therapy is warranted for that. So some of the things that they did for their intervention was gait training, obviously, to get that proper heel strike, and then 1st toe push off, as well as they did scar mobilization, range of motion, so they did joint mobs on the 1st toe, and then they also did strengthening exercises for the foot and ankle in general. I should also mention that for the first 4 weeks, they were in a special kind of shoe boot type thing that relieved the pressure from the forefoot, so that there wasn't as much pressure on the forefoot, which would also be applicable to the 5th metatarsal. So what I'm going to show you here with Matt is a couple of the strengthening exercises I would have my patient perform, as well as some joint mobs on the toe. So first, I'm going to do joint mob. So I'll have Matt's foot there, and then I'm holding on there at the base of the 5th, and then the phalanx, and we're mobbing there. So I'm doing that mob ventrally and then dorsally, and that was just to increase that flexion and extension in that joint. So then I would also have Matt do some basically some strengthening of the foot in general. So I'm going to have him pick up the marbles with his toes as best as he can. Good, and then bring it over to the bucket. Good. And so have him do that a couple times. Basically, it's just trying to get that clawing motion of the toes, increase that range of motion and strength in the bottom of his foot. Good. Okay. And then the last thing that I have him do along the same lines of strengthening is I'm going to have him put his foot up on this towel that we're using, and he's just going to work on scrunching his toes to move the sheet. There, not trying. Okay. It would work better if it was on hardwood floor instead of carpet. But so those were a couple of the exercises and range of motion things for my case. So thank you for watching.